Welcome. I'm Jocelyn Momenta.
And I'm Vicki Veltri. I'm Connecticut's healthcare advocate.
We're here to talk to you about the healthcare exchange, and this is one part of the Affordable Care Act that a lot of people really are not sure of. What exactly is the healthcare exchange?
Well, the exchange is really a marketplace. It's a place for people to go shopping for their insurance. And it's designed to be easy, a much easier shopping experience than you would have right now shopping for your insurance. So it's a place where you can go compare plans, compare prices.
All that will be there.
That's correct. And you can do it in multiple ways. So the exchange, even though it's called the exchange, has multiple ways for you to purchase your insurance. One is through the web-based portal like Travelocity, like Expedia. Another is through the phone. You can do it through the phone. You can call the call center. There'll be help there. And another is through the Community Assister program that we're going to have set up for people to get one-to-one assistance.
And we're going to talk more about that later on as well. But there is an enrollment period for this.
That's right. The open enrollment period, that's what we call it, is from October 1st to December 31st, although there is a little bit of an extension on that open enrollment so that we can get everybody in.
But you really want everybody signed up before that.
We would like everybody to be signed up early on because the plans actually start on January 1st, 2014. So people need to have coverage by then.
So they really need to get up and get all the information they need.
That's right. And the best way to do that is we're going to have a marketing effort, a really all-out marketing effort by the exchange itself to make sure people understand what the benefits are of being covered by an insurance plan. But also the Office of the Healthcare Advocate is going to have its program, which we're calling the Community Assister program, to get really out into the grassroots communities.
So you're going to have a lot of reminders out there for everybody.
That's correct. There will be no shortage of information going out.
Well, who will use the healthcare exchange?
Well, frankly, anybody who's uninsured right now in the state of Connecticut, and we have about 350,000 people in the state right now, they can use the exchange. And when I say the exchange, I mean this is meant to be a no wrong door entryway into coverage. So it could be for Medicaid, or which is the insurance program for people who have a little lower income, and then the exchange, which is private insurance plans.
Who actually runs the exchange?
The exchange is run by Access Health Connecticut. That's the official name of our exchange. There is a CEO, and CEO has a bunch of staff, obviously helping him. The CEO is Kevin Cunahan, and over him is an exchange board of directors, which is made up of some state officials, community people, some people with lots of experience in insurance. So the exchange board, of which I'm a member, I'm the vice chair of that board, is chaired by the Lieutenant Governor, Nancy Wyman.
Now, let's talk about the Access Health CT website. What exactly is this? Is Connecticut's online healthcare exchange?
Right, that's what I was referring to before. That is the portal, what we call the web portal.
Okay.
It's the way in to healthcare coverage on the website. So it's accesshealthct.com, and when you log on there, you can go into your online shopping experience. And we expect a lot of people to be shopping that way for their health care, particularly nowadays where people are more tech savvy. So we expect a lot of people to use the website.
Now also, most people will be eligible for help from the government to pay their premiums. Is that right?
That's correct. There is financial help available to anybody who has incomes between what we call the certain ranges of the federal poverty
level. It's a sliding
level.
scale.
It's a sliding scale. So the help you get depends on what your income is and your family size. So anywhere between or up to, $92,000 for a family of 4, you're going to get help, federal financial help, to assist you to buy your insurance, and it's substantial help.
And for somebody who's single, it's $44,000 roughly.
That's correct, and if your income's even lower, you also get help with cost sharing. So your co-pays, your deductibles, you're going to get a lot of help to afford the health care.
Which is what a lot of people don't know, that it's there for them.
That's correct. And that is why our marketing efforts are going to ramp up very soon to educate people about all these benefits of the exchange.
All right, let's take a look at what kinds of services will actually be covered. And the first one is, we'll run through a couple of them: hospitalization, doctor visits,
correct,
prescriptions, ER treatment, maternal newborn care, prevention. So
those
let's talk more about it.
So those are called essential health benefits. The federal law, which is we call ACA or Obamacare, said, you know what, we're going to offer you new insurance plans, and we're going to say, in those plans, you have to cover at least these 10 kinds of categories of benefits called essential health benefits. So those services will all be covered. In addition, the services that we already cover under Connecticut law will also be included in these plans.
Well, these are services that a lot of people haven't had.
That's right. Many people who are uninsured, they're just not getting this kind of coverage. They're not getting preventive coverage. They're also not getting the treatment they need when they need it. Prescription drugs often go without coverage. Mental health screenings and services. So there's a substantial number of services that will now be provided under the law.
Now, will certain factors like age or if somebody is smoking, will that have a difference in the pricing?
So right now, Connecticut law says, you know what, if you smoke, we might factor that in. But at the exchange, we made a decision not to penalize people for smoking the first year because we really want to get people enrolled. And in terms of age, right now, if you're trying to get covered under a regular policy in the state of Connecticut, if you're between about 50 to 64 years of age, you're going to pay 6 times more than somebody who's about 25. But under the ACA, the maximum range of coverage is 3 times more. So you may have to pay 3 times more, but that's it.
But you said the smokers, so they have a year.
At this point in time, right now, yes, if you're a smoker, you will not get penalized for that in the first year at least. The board has made that decision.
All right, so what should you really look at when you're deciding on a health plan?
Well, there's so many factors to look at. One is, and I think for most people, one of the most dominant things to think about is who's in my provider network. Can I still see the providers I'd like to see? Price. Price is a key issue. How much is my premium going to be? How much is my cost sharing going to be? Does the company in general have a good reputation? So things like that are all factors that people should consider when they're purchasing an insurance plan.
Yeah. As a matter of fact, you also talk about health maintenance organizations, a point of service, a preferred provider organization, or some other types of plans. So that will all be there?
Yeah, that will all be there. And what the portal is designed to do, and what also the assisters will do, brokers will do, the phone people on the phone at the call center will do, is explain the differences between those types of plans. Because it is important. So if you are in an HMO, that means, you know what, you have to stay with your network providers, or you're going to have to pay out of pocket on your own to serve them. If you're in a PPO, what we call preferred provider organization, or a POS type plan, you may have coverage for out-of-network services by your insurance plan. So you'd pay less if you went out of network, for example.
So let's take a look at the levels.
Yeah.
Because you have them broken down as bronze, silver, gold, and platinum.
Right.
Let's look at bronze first of all. If you choose the bronze level, what should you expect?
So if you choose the bronze level, what that essentially means, think of this as, like Olympic medals, right? Bronze, silver, gold. If you're getting a gold plan, you're probably getting the best plan. So if you're going to get a bronze plan, what you're going to get is reasonable coverage, but it's going to cost you more. You're going to pay more out of pocket to get a lower priced plan. The range of the coverage that's in the plan is still good, but you have to pay more out of pocket. So it will be cheaper in terms of the price every month that you have to pay for your premium, but you'll have to pay more in co-pays, in deductible,
And
things like
bronze
that.
would appeal to whom?
Bronze is essentially probably a healthy person who doesn't need to go to the doctor a lot.
Single?
Yeah, single adult probably who's one of those healthy young invincibles that we call them. A bronze plan would likely appeal to someone like that.
All right, the next plan would be, of course, silver.
Silver plan. The silver plan means, and all of these plans, so bronze, silver, gold, platinum, they have, they're called that for a reason, and that is because the higher up you go in the bronze, silver, gold, and platinum, the more robust the plan is, the less you have to pay out of pocket once you have coverage. However, the higher up you go in metals, so that platinum is the most expensive every month because you have the least cost sharing. So it's important to remember that the coverage is about the same in every plan in terms of what's offered, but what you spend out of pocket is more the lower the metal. So for bronze, for instance, you pay 60%, or excuse me, the plan pays 60% of the cost of the plan, you pay 40. Silver, the plan pays 70. You pay 30.
The gold is at 80.
You pay 20.
Platinum is at 90.
That's right. The plan pays 90%, you pay 10%.
But people also have to remember they have the premium
That's
as well.
right. The premium is higher in the Platinum plan than it will be for the Bronze
So
plan.
and explain to everybody what the premium is for those who may not know what
So
that
the
is.
premium, what a premium is what you pay out of pocket every month to
have that
maintain your
plan.
coverage. That's
Exactly.
right. And we don't know right now exactly what those premiums will be, but you just have to remember, if you want the more robust plan, meaning you pay less in co-pays, less in co-insurance and deductibles, you will pay more every month for that.
Okay. Well, are they basically standardized across companies and the exchange so that people can actually compare apples to apples?
Right. So what we did was, as an exchange, we decided, and this has sort of been the experience in other states, that we wanted to have one plan, at least one plan, that people could compare completely across different insurance companies. So we call that the standardized plan. So everything about those plans is equal. And the only thing people would be comparing is whether their providers are in the network or not, and what the price is for the plan.
All right, so where can people go to get help for signing up for insurance here in Connecticut?
They can go to the Access Health CT site, accesshealthct.com. The other place they can go is to the Office of the Healthcare Advocate. And you know, the Office of the Healthcare Advocate assists people with any questions or concerns they will have about open enrollment, what the plans look like, etc. You should feel free to call us on our toll-free number, which is 1-866-466-4446, or you can visit us online at ct.gov/OHA. We speak Spanish, we speak English, we are educators, we are advocates, and you know, I'm Vicki Veltri and I'm your healthcare advocate.
And I'm Jocelyn Momenta. Thanks for watching.